Hello everybody, Dr. Cord here from the Vreeland Clinic, and today we're going to talk about heart disease and how to properly assess your own risk. The traditional way of checking cholesterol, which is associated with heart disease, is to check total cholesterol, HDL or good cholesterol, LDL or bad cholesterol, and triglycerides. And while that's a valuable screen, the National Cholesterol Education Program says that that can only properly identify about half of the people at risk. And we know that the statistics show that people who have heart attacks, about half have normal cholesterol and about half have high cholesterol. So clearly we're missing something. So today I'm going to fill you in on some of the things that you can check for in addition to those regular screens. Perhaps one of the first things you can look at is lipoprotein A, often not checked. It's a very strong independent risk factor. It's a very dangerous particular type of cholesterol. It increases the risk for clot. It also very easily penetrates the walls of our vessels to form plaques. And it doesn't really respond very well to the traditional treatments like statins or diet and exercise. It actually doesn't respond at all. The only thing it does respond to is niacin. So lipoprotein A is something to look for. Now, LDLs can be broken down. They can either be large and buoyant or they can be small and dense. And we want to know how many of the small and dense particles do you have. So we want to check for small, dense LDLs. They more easily penetrate the walls of our vessels. This really allows them to build plaque very, very easily. And we want to know how many of them are present. The more that are present, the more problematic it is. We also want to check a particular type of HDL. Okay, HDL again is the good cholesterol, and HDL traditionally scavenges cholesterol from the body and returns it back to the liver. So it basically removes cholesterol from circulation. The HDLs are created or made in our liver as HDL3. As they circulate and they collect cholesterol, they become this HDL2B, and this is something that can be checked. We want to check for HDL2B levels. Those levels correlate significantly with how well are you removing cholesterol. Low levels are associated with your inability to remove cholesterol from the circulation, and high levels obviously mean the opposite. You're doing a very good job of removing cholesterol. So that's something to check. Now, two inflammatory markers that we want to check. The first one is something called high sensitivity CRP. Now, CRP is a protein that's manufactured in response to inflammation. It is what they call an acute phase marker. It's not very specific for any particular problem, but we do know that high levels of circulating high sensitivity CRP are indicative and very predictive of heart disease, and they are particularly predictive of future cardiovascular events in people who are asymptomatic. So people who don't have any symptoms, it's very important to check CRP. The other inflammatory enzyme is homocysteine. It's an amino acid. It naturally occurs, but in very small quantities in the body, and high levels are associated with an increased risk for heart disease, stroke, clotting, and Alzheimer's disease. So this is something that we should check, and we do know how to properly take care of that. It's very easy with some B vitamins. The other thing that you want to check in addition to this is insulin, fasting insulin. If your insulin is very high, it indicates you have a very difficult problem controlling blood sugar. If blood sugar is high, that significantly increases the risk for metabolic syndrome and eventually diabetes. These things we know significantly increase the risk of cardiovascular disease and make cholesterol numbers that much more important. If you have any questions, feel free to give us a call here at the Vreeland Clinic. I will put up a slide with all the information we just talked about, and if you have any questions, let us know. We look forward to hearing from you.